Under drug classes, we have alkylating agents. So these are classes of drugs that are capable of forming covalent bonds with important biomolecules. The major targets of drug actions are nucleophilic groups present on DNA. It used in the treatment of cancer, and it interferes with the cell's DNA and inhibits the cancer cell growth. The mechanism of action: as a class, the alkylating agents exert their cytotoxic effects or chemotherapeutic effects by transfer of their alkyl groups to various cellular constituents. The major site of alkylation within DNA is at nucleophilic sites, mainly the N7 position of guanine. Sa picture, it is the alkylation of guanine, N7, and subsequent depuration of DNA. So the most important of these for many alkylating agents is yung N7, whose nucleophilicity may be enhanced by adjacent guanine residues. So alkylation converts the base to an effective leaving group so that water leads to depurination and the loss of genetic information if the resulting depurination is not repaired by the cell. For organoplatinum compounds, there are three are currently used in clinical practice. So one is cisplatin. Cisplatin was discovered by Barnett Rosenberg as a result of experiments investigating the role of electrical current on cell division. So based on Escherichia cells in an ammonium chloride solution had an electrical current applied through platinum electrodes. It's available in 10 and 50 milligrams vials for IV administration in the treatment of wide variety of cancers, including non-Hodgkin lymphoma. So this is a type of cancer that begins in our lymphatic system. Lalo na sa ating white blood cells, yung lymphocytes natin that nag-grow sila abnormally and can form tumors. Then bladder cancer, ovarian cancer, testicular cancer, and cancers of the head and neck. So cisplatin and others are eliminated by the kidneys and excreted in the urine, resulting in renal dysfunction. Carboplatin, so it is the second generation platinum. However, in contrast to cisplatin, it exhibits significantly less renal and gastrointestinal toxicity. It is available in 50, 150, and 450 milligrams vials for IV administration in the treatment of ovarian cancer, bladder cancer, germ cell tumors, head and neck cancers, and small cell lung cancer. So this agent is widely distributed upon using IV administration, but it binds slowly to plasma proteins. That is why it requires 24 hours to reach 90%. It is eliminated in the urine with a terminal elimination half-life of 2 to 6 hours. So the main dose limiting toxicity is myelosuppression. Lastly, for organoplatinum compounds, we have the third generation diaminocyclohexane is the oxaliplatin. It is available in 50 and 100 milligrams vials for IV administration. It plays a major role in the adjuvant therapy of stage 3 colon, ovarian cancer, and metastatic colorectal cancer. It is eliminated in the urine half-life of 240 hours. Main dose limiting toxicity is neurotoxicity because it is manifested by the peripheral sensory neuropathy. Other adverse effects include nausea, vomiting, diarrhea, myelosuppression, and hypersensitivity reactions. Individual agents, we have mecloratamine. So it is available in intravenous administration in the treatment of Hodgkin lymphoma. Also used topically in the treatment of mycosis fungoides. For its mechanism of action, it forms a DNA cross-links, resulting in inhibition of DNA synthesis and function. Its adverse effects include dose-limiting myelosuppression and nausea or vomiting. For IV administration, may tendency na maka-feel ka ng pain sa injection site. Additional adverse effects include alopecia, azoospermia, amenorrhea, hyperuricemia, which is a high uric acid level sa blood, and an increased risk of secondary cancers. Then we have chlorambucil. It is available as 2 milligrams tablets for oral administration in the treatment of Hodgkin's lymphoma and chronic lymphocytic leukemia in combination with Nison as a single agent. And so chlorambucil is well absorbed, 75% upon oral administration and highly protein bound. So the drug is eliminated via kidneys with a terminal elimination half-life of 1.5 hours. Adverse effects include dose-limiting myelosuppression, nausea and vomiting. Additional adverse effects include hyperuricemia, so this is a high uric acid level in our blood, azoospermia, amenorrhea, seizures, pulmonary fibrosis, and skin rash. Melphalat, so it is available in 2 milligram tablets and 50 milligram vials for oral and intravenous, respectively in the treatment of multiple myeloma. So it is a cancer nang nag-form siya ng mga cancerous plasma cells sa ating bone marrow and crowd out healthy blood cells. Also treatment for breast and ovarian cancer. And in high dose naman, it is used sa bone marrow transplant. Then, elimination occurs primarily in the feces with an elimination half-life of 38 to 108 minutes. Adverse effects are myelosuppression, nausea, and vomiting. Last adverse effects naman are hypersensitivity reaction, skin rash, and alopecia. For cyclophosphamide, available siya in 25 and 50 milligram tablets for oral administration. And sa intravenous naman, available siya in 200, 100, 500, 1,000, and 2,000. And it is used in the treatment of cancers including breast, non-Hodgkin's, chronic lymphocytic leukemia, ovarian cancer, bone and soft tissue sarcoma, rhabdomyosarcoma, neuroblastoma, and Wills tumor. Eliminated in the urine with an elimination half-life of 4 to 6 hours. Effects, it includes dose-limiting myelosuppression. For Thiotepa, it is available in 50 milligram vials for IV administration in the treatment of bladder cancer, ovarian cancer, and breast cancer. Its equation profile is accounted only 10% to 22% of the administered dose. The elimination half-life of the compound is 2 to 3 hours. Adverse effects is myelosuppression and mucositis. Additionally, nausea, vomiting, skin rash, hemorrhagic secondary cancers may occur. For busulfan, it is available in 2 milligram tablets for oral administration, 10 milliliters vials for intravenous administration in the treatment of chronic myelogenous leukemia. And pag high dose naman, it is for refractory leukemia with bone marrow transplant. Its metabolites are excreted primarily in the urine. The terminal elimination half-life is 2.5 hours. Adverse effects includes myelosuppression, nausea and vomiting. Pulmonary symptoms including intestinal pulmonary fibrosis, which is referred to as the busulfan lung, occurs belatedly, and although it's rare, it is severe. Then we have carmustine. It is available as 100 milligram vial for intravenous administration in the treatment of several types of brain tumors, Hodgkin's and non-Hodgkin disease, and multiple myeloma. So this agent is very lipid soluble. That's why it easily crosses the blood-brain barrier, achieving concentrations greater than 50% of those seen in plasma. So the half-life of this agent in plasma is short. It is only 15 to 20 minutes because of rapid decomposition. Myelosuppression is dose-limiting and may present as thrombocytopenia, leukopenia, or more rarely as anemia. In carmustine, rarely lang nag-occur ang pulmonary toxicity at low doses. Sa high doses naman is seen during bone marrow transplant present as dyspnea, cough, pulmonary infiltrates, and progress to respiratory failure. Other toxicities include nausea, pain at the injection site, impotence, sterility, amenorrhea, infertility, and risk of secondary cancer. For lomustine, it is available in 10 to 40, 100 milligrams capsules for oral administration in the treatment of primary and metastatic brain cancers and Hodgkin lymphoma. It is lymphophilic, well absorbed, and widely distributed, and that's why it crosses the blood-brain barrier. Its dose limiting is myelosuppression and presence in a manner similar to that seen with carmustine. Other toxicities include nausea, vomiting, anorexia, impotence, sterility, amenorrhea, and infertility. So meron din siyang pulmonary and renal toxicity but increases during high-dose therapy. Then we have here individual agent under nitrosurias. So nitrosurias are highly and lipid soluble. That's why they can cross the blood-brain barrier and are used to treat brain tumors. So these are a group of cancer drugs called alkylating agents because they act by the process of alkylation to inhibit DNA repair. Under that, we have streptozocin. It is available in 1 gram vials for IV administration in the treatment of metastatic islet cell carcinoma of the pancreas, colon cancer, and Hodgkin disease. It is hydrophilic, rapidly cleared from the plasma with an elimination half-life of 35 minutes. In dose limiting, we have renal toxicity, initially as proteinuria and azotemia, but may progress to renal failure. Nausea and vomiting may be severe with the agent, and myelosuppression is generally mild. For individual agents, you have procarbazine hydrochloride. It is available in 50 milligrams tablets for oral administration in the treatment of Hodgkin's and non-Hodgkin's disease, brain cancer, and mycosis fungoides. It is rapidly and completely absorbed after oral administration, and it is metabolized in the liver to give azoprocarbazine. So this is the plasma kinetics of procarbazine and its major metabolite, followed by further oxidation to methyldiazine and aldehyde. Elimination occurs in the urine mostly as metabolites with an elimination half-life of 1 hour. Myelosuppression is dose limiting, generally presenting as thrombocytopenia that may be followed by leukopenia. Naman na deficient sa glucose 6-phosphate dehydrogenase, makadevelop sila ng hemolytic anemia during procarbazine therapy. Other adverse effects include nausea, vomiting, hypersensitivity, flu-like symptoms, amenorrhea, and azoospermia. The central nervous system symptoms effects may be seen, including lethargy, confusion, neuropathies, and seizure. For the carbazine, it is available in 100 and 200 milligrams vials for intravenous administration in the treatment of Hodgkin disease, malignant melanoma, carcinoid cancer, neuroblastoma, and soft tissue sarcoma. Elimination occurs to the urine with 40% to 50% occurring as unchanged drug. Dose-limiting myelosuppression presents as both leukopenia, so decrease in the number of white blood cells, then thrombocytopenia naman, sa kondisyon na kung mayroon kang low blood platelet count. Other adverse effects include nausea, vomiting, flu-like symptoms, photosensitivity, and pain at the injection site. Lastly, we have altertamine. It is available in 50 milligram capsules for oral administration as the second-line treatment for ovarian cancer. This agent is well absorbed upon oral administration, well distributed, and highly 90% plasma protein bound. This agent's spectrum of activity is similar to the other alkylating agents, however, cross-resistance is not seen. Elimination occurs primarily in the urine as mostly demyelated metabolites are seen, with terminal elimination half-life of 4. For its dose-limiting toxicities, it is myelosuppression and nausea or vomiting. Other adverse effects include lethargy, agitation, hallucinations, skin rash, and elevations in transaminase levels flu-like symptoms, abdominal cramps, and diarrhea.